This is Montreal Now with Aaron Rand and Natasha Hall. CJAD 800.
That is James MENNIE. He is over at the Montreal Gazette. Jim, just before we start, I'm just being made aware here. New York Times is reporting that the strategically important city of Kherson in southern Ukraine has fallen to Russian forces, becoming the first major city to come under Russian control since the war began last week. So I just wanted to update for that right now. The city of Kherson, Kherson, in southern Ukraine. Jim, I guess we can start today by talking about what Jason just reported at the top of the hour with respect to mask mandates in Quebec basically disappearing. What do you think?
Well, if you thought you were getting mixed messages out of Ukraine as to what's going on over there, I'm not trying to make light of what's happening in Ukraine, but take a look at the messages we've been getting from the Legault government and from health authorities as to what's going on with the pandemic. There had been talk that they were going to make some kind of an announcement either today or tomorrow concerning the use or withdrawal of the use of masks. And once again, we seem to be proceeding by government by leak. We're seeing just now, maybe a half hour ago, it's going to be by the end of May or by the month of May, you won't have to wear a mask anymore. Earlier today, the public health authority decided to say, listen, we've looked at it, we've done our modeling, we've done our projections, and we think that if we begin easing regulations by March 14th, we shouldn't see the same kind of spike in cases that we saw last January. And the rationale for this, apparently, for this extrapolation, is that they presume in the greater Montreal area, 1 out of 3 people have become infected at one point with the coronavirus. But they also point out, we're also presuming that's true. So that's our projection, that it won't be that big a deal. We have 2 scenarios. One says, well, if there isn't a lot of social contact in the wake of those regulations being eased, we should not see an increase in cases. But if there isn't, if everybody decides to go square dancing on the same night, apparently cases will increase, but they doubt it'll increase at the same rate as it did when we had the 5th wave, the Omicron wave. So take from that what you will. It seems to me to be a very convoluted way of trying to handicap a horse race, even though you don't know what horses are in it. And now we're hearing about masks. And I guess the question I have, Aaron, and perhaps the question a lot of our listeners have, is, okay, government says you don't have to wear a mask. Are you going to stop wearing a mask? Government says that, perhaps vaccine passports will not be mandatory. Will companies and stores and restaurants stop asking for them? Or if people become sufficiently conditioned to the Lucy grabbing the football away at the last minute with this pandemic, that I'm not going to take the chance. I've been vaccinated. Why should I take those risks? And the fundamental question, of course, is why is this all happening now?
Yeah.
And why have we gone from, it was supposed to be March 14th, and now there seems to be some dithering up in Quebec City about, well, maybe it'll be March 11th or 12th. Like, what difference is 48 hours going to make? And then, of course, all of this unfolding today over the last 12 hours in the context of what I thought was a really good hit by Radio-Canada, determining that on December 30th, when we were told, sorry, got to go back into curfew, all right? And that announcement came at 5 o'clock. Well, by 2:30 in the afternoon, the government still didn't have any scientific explanation for why they had to impose a curfew. And despite the fact that the Montreal Regional Health Authority said, no, this is not a good idea, they went forward with it anyway. And now, of course, the opposition is having a bit of a field day with this, proving once again that they're improvising, as it's a word we often use on this show to describe this government. They were just improvising. What possessed Legault to announce a curfew, what it was based on, which was apparently certainly not science. What was the rationale? Was it to appear that he was taking this seriously, and we have to go back into sort of semi-lockdown? That's the scary part, because when they zig and zag like this, when they make it up as they go along, even the most reasonable people who have put up with so much over the past 2 years will turn around and say, you know what, the hell with you all. I don't care what you're saying. I don't believe you. I will do what I think is good for me. And if that person says, I'm not wearing a mask is whatever, and we'll say, okay, that's how public opinion has evolved. But what happens if they find another stupid variant? What happens if we wind up back in this again? How willing will people be, not just to make the sacrifice, but to even pay attention to what the government's telling them?
You know, it's interesting as you describe it, Jim. I think this idea of, I've done what you asked me to do and you're changing this all over the place and all the time. I think a lot of people, I think that number gets larger and larger of people who've already decided that that's how they're going to approach this going forward, right?
I think so. I have to tell you, I've ranted about this before. Yes, I understand I have to wear a mask. I loathe wearing a mask. It's only because my glasses keep fogging up and it drives me nuts, okay? But the fact is, even there, I find myself, and I don't freak out, and I'm not like, people say, it's a violation of my freedom. I'm ripping off my mask with a little more vehemence than usual when I walk out of a store or whether I walk out of some place where I'm obliged to wear it. And, of course, the other thing that I find confusing is, and once again, I could be wrong because who knows who's leaking what to whom when it comes to masks today anyway. I've also heard, well, no, it'll still be necessary on the metro. Well, good luck with that. I mean, it's bad enough, if you use the metro, you will see a few people out there who either aren't wearing the mask correctly or not wearing a mask at all. And now if we have a situation, well, you have to wear it in the metro, some parts of which are the size of Notre Dame Cathedral, but you don't have to wear it anyplace else. The lack of consistency, confusion, apparent improvisation, it's unfair to Montrealers. It's unfair to Quebecers because in the end, we don't know for a fact how to deal with this.
I got to tell you, again, in hearing you say this, it seems to me the government is basically saying to itself and now telling us this is over as far as a serious disease or illness is concerned. You're on your own. Go out there and don't even think about the fact that if another variant is coming down the road, we're going to have to start this all over again. It's like we want nothing to do with this anymore.
I know, but in the meantime, Aaron, we're also in a situation where the 12,000-pound gorilla, which has been dictating health policy, which is the spit and bubblegum state of our healthcare system. Well, right now, the bed count is down and the ICU count is down, but that can change. I mean, COVID-19 is not the only reason you get sick around these parts. Who knows? Traditionally, summertime, which seems to be a relatively, I have to use the word, easier time when it comes to dealing with COVID-19, it's also the time a lot of people go on vacation. It's a traditional story around the Christmas holidays and during the construction holidays or summer break. The ER numbers go through the roof, capacity numbers go through the roof because there's a lack of staff. A lot of people are on vacation. As far as I know, that hasn't been addressed. As far as I know, we haven't suddenly had that big paradrop of nursing staff that Christiane Dubé has been talking about for, at this point, years. But in the meantime, mixed messages to an exhausted and I think even more worrisome, a disinterested population. I don't like where this is going. I hope the government is guessing right, but I wish they weren't guessing at all.
Yeah, well, sadly, that's what sort of comes with something you've never had to contend with before, right? There is just a certain amount of guesswork that's always going to be there. I think we found that out now. And as I said, I think if we end up, Jim, with another variant, and it's serious in the way that, say, Delta was or Omicron is now or was, the government simply, it seems to me, their out is to say, well, you wanted all this stuff back. We got rid of the mask mandates. We opened the bars. We opened the restaurants. Now people are getting sick and dying again. It's your fault, as in it's our fault, because we're the ones that pressured them into relaxing these restrictions to begin with.
Well, they'll first of all, they'll blame the health establishment. Remember, that everything they say, oh, no, it's the health people telling us to do this, or not do this, or change this, or reduce this. And I'm not entirely sure. I mean, they can try that excuse, but honestly, most people that I know, and I flatter myself, I know a fair cross-section of people, some of whom are completely fed up and never were happy with the measures, who are not going to run, in slow motion through the meadow, that these, suddenly it's over. I think we realize to a certain extent this will never be over. Just how much a part of our lives is going to depend, I think, on our reaction and on how we conduct ourselves individually. But like I say, I think a lot of people have already made their minds up, and I would not be surprised if it's as perhaps difficult to get a face mask in May as it is right now.
Well, we shall see. And again, for people just tuning in and wondering what's going on here, so the announcement is, we reported this on our 4 o'clock news, that the mask mandate is in fact coming to an end. And as you described, Jim, everywhere else but in public transit, we're going to have to wait.
And once again, I mean, I understand what you're saying, Aaron, but I think you're giving it too much dignity by calling it an announcement. There has been no announcement. We're just getting little bits and pieces of leaks on a fundamental issue of healthcare, of public safety. And this is how the government's proceeding. They weren't shy to hold press conferences before. Why are we learning about this way today?
Fair enough. That's a fair question to ask. I wonder why. I wonder if we will have a press conference tomorrow to announce this, because we have not seen any indication of that, at least not yet today.
No.
Jim, thank you. Appreciate it.
Take care, Adam.